I mean, it's, you know, no secret that this is a hard time for many people in our country. And I think it's, you know, science has been hit also pretty hard by the pandemic. So lots of laboratories have had to, you know, temporarily shut down and are now trying to get back up and going. And a lot of cancer research foundations are hurting financially because it's a hard time to raise funds. And so I think that's going to be particularly hard on junior faculty starting their laboratories because they really depend on this type of funding to kind of get going and get started and launch new and exciting projects.
Funding from Concern Foundation is extremely important for our laboratory research since we're proposing a very high-risk, high-reward project. Which we believe will have a very significant impact on clinical management of squamous cell carcinoma patients. But with the Concerns Foundation funding, we can now start to work on this high-risk, high-reward project. And our goal is to generate important preliminary data so we can build on to apply additional funding and eventually translate the finding to help patients.
I think for me personally, it's difficult to overstate the importance of funding from the Concern Foundation and related organizations. I think at this early career stage where you're trying to develop preliminary data to support these projects and get your research program off the ground, this sort of funding is critical to really ask these new questions, especially using new techniques, approaching these questions in ways that they perhaps haven't been addressed before. And for us in particular, as we're fairly new to the world of cancer research, but I think bring new perspectives to the field, I think it's very helpful for us to establish this new project area and establish new sorts of methods to probe these questions and ask questions that haven't been addressed before, particularly in the context of microbial infections.
This particular funding and the grants like these are absolutely essential to fill the gaps that actually many young faculty like myself face when they start a lab and you're actually starting on a very high-risk projects to generate some critical data to be able to get a long-term funding from government organizations such as NIH or DoD.
It is of the utmost importance, especially for faculty at my level, to have access to these kinds of opportunities. These two-year grants are so important in helping us get the ground level data to be able to explore innovative questions in a way that we wouldn't be able to without this funding. And having access to this grant and being able to again ask and answer these new questions is important in generating a wealth of data that is going to serve us well for asking and answering new and bigger questions in the future. So without this opportunity, it would be very hard to sustain larger funding for a longer period of time. But really, in getting to test a lot of these very new ideas where we don't really have another opportunity to do so.
What we really need, and the reason why this is a really great opportunity for me, is that we have now funding to explore these new ideas. Like, for example, when I talked about hypoxia, and we can, really use the funding to lay some groundwork for further studies. And that's practically impossible without foundation support because, we come in and we have all these ideas, but we really don't have the data to support them. So we need someone to believe in us enough to be able to really lay the groundwork and then establish the preliminary data.
Funding like this gives researchers like myself the opportunity to kind of dive into novel ideas and to generate a lot of data that will help with larger grants in the future. And it's also nice to have foundation grants because it really, there's always a story behind the foundation and always people behind the donations. And it's just nice to have that connection, to feel supported by individuals rather than kind of an institution. And we often share the same mission, which is, to reach patients and to make differences in terms of the therapeutic options available to patients.
It's difficult to start something, especially if it's innovative. Most of the grant systems that we have established through NIH, they are mostly based on science and research that has very little risk involved. And I think a grant like this one from the Concern Foundation, it allows us to be more risky and to achieve higher things that otherwise it would be hard to secure any fundings for that.